This is best described by the comment Matt Hancock, the Health and Social Care Secretary, made. Poor NHS tech is downright dangerous. And he went on to say, enough is enough. My mission is to bring health services IT system into the 21st century. This requires a radical change to manage patient records in one place rather than being scattered across multiple disjointed systems or silos between and within primary, secondary, and social care. By this, I do not mean centralized databases, because history tells us that they never work. Instead, patient records can be managed locally for a GP practice or a hospital catchment area or on a local authority level. Why is this significant? Because a problem can only be solved if its scope is well defined. Past major programs worldwide have failed because by the time the scope has been defined, things would have changed beyond recognition. So the challenge is not simply find better ways of making systems talk to each other, but to have a complete rethink about how care is delivered today. Today's healthcare solutions are built as point solutions, that is, building a solution for a GP practice, a hospital, a care home, etc. Their design is therefore based on what the designer perceives the GP, hospital consultant, or the care professional need. As these needs change from one day to the next, these solutions tend to solve yesterday's problems. If we are to have solutions that are fit for the 21st century, we need to start from the notion of keeping citizens healthy rather than to treat them when they become ill or have an injury. This immediately changes the focus from broad brush care to personalized and preventative care. One of the major NHS priorities today is supporting care for people with multiple chronic conditions in their homes. In this case, care has to be specific to the individual patient, so their homes will be fitted with different sets of devices and technologies for measuring, monitoring, alert, etc. It can also include predictive analytics and AI to enable early interventions. So the key here is to create an environment where we can harness the benefits of the innovative technologies as they become available. This is where managing patient records in one place and independently of how they are used will come into play. It will make it possible to build next generation healthcare solutions like hardware products are built today from modular components. We can order a car, phone, or other product and add optional extras to personalize it to our individual needs and lifestyles. We can do the same with next generation healthcare solutions. Managing patient records in one place is the essential next step to enable the move to citizen-centric preventative health and social care, with a focus on keeping citizens healthy in the first place rather than the current reactive way of treating people when they become ill or have injury. I can see a future where each person has a personal care plan which is used as a planning and execution tool. The planning side is done by working out what resources are needed and their cost. The execution is done by monitoring how the patient responds to care, and the plan is refined accordingly. For instance, effecting early interventions in the event of change, both positive and negative. Like any radical change, this will be slow at the beginning, but accelerates when a tipping point is reached. I think the tipping point can be reached quickly for three reasons. The first is by eliminating human error. This immediately releases care capacity, the equivalent of a significant new injection of funding into the health care system. The second is to focus on needs that are not being met by current generation of solutions. Care for patients with multiple chronic conditions is a perfect example of this. The third is accelerating the adoption of emerging innovative technologies that will help deliver better, faster, and smarter ways of delivering care.